This is NBC10 News.
Saving lives with 3 simple numbers. 988, a new mental health crisis hotline, rolls out tomorrow. 988 will connect callers to a trained crisis worker who will listen, offer support, and offer mental health resources. NBC10's Lauren Make is joining us live in the studio to explain how this will work. Lauren?
Well, Jim, the idea behind 988 is to get you help that is specific to your personal needs. First responders can get involved, but this is specifically tailored to mental health needs, not law enforcement. It is something one provider says can help prevent tragedy.
I'd said during the roundtable that our greatest disappointment was that we didn't get an opportunity to help him. 988 would allow us to do that.
John White talking about Walter Wallace Jr.,
the night down,
a Philadelphia man shot by police in 2020 as he was having what his family has called a mental health crisis. Today, the head of the Consortium, which offers behavioral health services, pointing to a new tool for individuals, families, and those who want to help them, a phone number for a suicide and crisis lifeline.
It would not be routed through 911. 988 would have led us directly into a behavioral health provider who could have been there on any one of the 3 calls that were made on 911 to prevent this tragedy and to keep that family safe and whole.
The 988 line becomes available on Saturday across the country.
You now see the alignment in terms of the Biden administration, the Harris administration, aligning so that we can avoid what happened in Walter Williams' case.
The goal is for calls to be routed to local trained counselors.
If you are in crisis, don't wait, reach out. If you fear you may be in crisis, don't wait, reach out.
The VA secretary today said veterans can press 1 after calling the 988 line to get to the Veterans Crisis Line. The launch attracting 2 cabinet secretaries, and the recent gun legislation signed by President Biden offers some funding, but the Health and Human Services secretary says state governments will have to take some responsibility.
The governor's got to own this. They got to treat it as something for their family. It's got to be a responsibility that the states, the tribal governments, the territories take on.
I asked Secretary Beccera about mental health services for those in need.
What can you do after this call to make sure that people have access to doctors and therapists going forward?
So if you recall, during the President's State of the Union address, he made a historic commitment to mental health.
He pointed to a need for additional investment.
We're committed. With the help of Congress, we can make sure that states like Pennsylvania have the resources they need so that phenomenal crisis centers like the one we just came from have the support that they need.
Do you feel that you need that legislation in order to assure that that access is there, or are there other things you can do now?
If we're going to take it to the next level, at least at the federal level, in supporting our state and local partners, we absolutely need that.
Well, the goal is to get callers to local trained counselors. The FCC chairs, they're working to triangulate between cell phone towers to figure out where you are. And also a reminder of what we talked about last hour, that you can also text 988 to chat with someone. Jim?
So you've got 2 options there,
Yes.
either, speaking or texting. Maybe they don't feel like talking about it, but they're more comfortable texting. Lauren Make, thank you. Important addition. Appreciate it.